So, hi everyone, and thank you to be here with us. So, to this panel, which is about enabling technologies for advancing exposomics, I'm Emilie Calabre. I'm a biochemist and biotech engineer working at MEERSENS, a company who develops environmental models and AI tools to assess the risk on people's health.
Thank you so much, Emilie, and welcome everyone. We're excited you're here. I'm Rima Habre. I'm an associate professor at the University of Southern California, and I'm also one of the MPIs of Nexus with Gary Miller and Chirag Patel. We're very excited to introduce our amazing panel today. We have Dr. Ben Barratt, who's with us online. I think you're going to be able to see him up there at some point. Dr. Barratt is a professor in environmental exposures and public health and director of the School of Sustainability at Imperial College London. He is an environmental exposure scientist specializing in the innovative use of environmental monitoring technology. And then we have Dr. Este Geraghty, who is a chief medical officer at Esri, where she leads messaging for health and human services. With a background in medicine, public health, and geospatial technology, she focuses on the integration of location intelligence into health workflows to uncover environmental, social, and structural determinants of health. And if you don't mind, Emilie, I'm going to introduce Dr. Geetha also. Dr. Geetha Senthil serves as Deputy Director of the Office of Spatial Initiatives at the National Center for Advancing Translational Sciences, also called NCATS of the NIH. She also leads quantum technology initiatives at NIH.
And I will finish with Dr. Krystal Pollitt. She is an associate professor at the Yale School of Public Health. Her research team has pioneered exposomic technologies that leverage high-resolution mass spectrometry, including a wearable passive sampler to assess personal exposure to thousands of contaminants and non-targeted analysis to expand coverage of emerging chemicals in environmental and biological matrices.
So we'd like to quickly remind you about the objective of our panel. It's about advancing technologies, and it's really about exploring how the human exposome will be characterized, focusing on future challenges and innovative ideas. We would really love for you all to be thinking about your questions as we get started. We'll have a chance at the end for you to ask those. And just as a reminder, we have this incredible panel of experts all the way from measurement sciences and technologies, from the chemical analytical space to air quality sensors to citizen science networks and exposure assessments for air pollution, geospatial sciences and technologies, and quantum sensing, which is a very exciting field. So keep that in mind as you think of your questions. We've also given our panelists 2 prompts or questions to make them kind of think about that future and what we're trying to envision today together. They're both very difficult questions, so when you ask your questions, please be nice. But one is, what is an uncomfortable challenge that the community must face and overcome? The other is an impossible proposal or idea. So we've given them the option to pick one of those questions. And I think, Dr. Barratt or Ben, if you don't mind, since you're virtual, we'd love to kick it off with you. What's that uncomfortable challenge that we must face and overcome? Thank you.
Thank you, Rima. And apologies to everyone for being virtual and not being there in person. So I work with wearable technology. And with wearables, context is everything. You've got no fixed point except the person who's actually carrying your sensor. And in true exposomics research, we really need to extrapolate both temporally and spatially. So we really need to understand where the stresses are coming from, environmental stresses, health stresses, in order to understand them and extrapolate to a sample greater than whoever is carrying the sensor. And that might be activities, it might be surroundings and proximity. And people like Esri can do amazing things spatially with geographical systems. And a lot of our assessment processes have been spatial in nature, especially exposure assessments. But we really need personal data sets for exposomics research. So my uncomfortable challenge is actually the weird, irrational, and unpredictability of human beings. you don't get a much bigger challenge than that.
Very true. Over to you, Emilie.
Thank you. Dr. Senthil, what will be for you an impossible idea or proposal?
Since we are in enabling technologies, I'm going to say the fabrication of sensors, especially designing classical integrated with quantum hybrid sensor network. It's an engineering challenge and also communication, data analysis. It involves tremendous challenges at various levels. Why I'm talking about quantum sensors is because of the tremendous opportunity it provides. It's not yet tapped into for Exposomics. I recently launched a quantum sensing technology challenge area topic at NIH. One of the interests is also to look, measure, it's a measurement, quantum measurement technologies to identify ultra-low concentrations of exposures and how it impacts human health in terms of assessing, again, low levels of biomarkers. So if we imagine a day when you could integrate these ultra-sensitive atomic scale sensors into classical sensors, where you can measure at really high resolution these hotspots of exposures in, for example, industries and homes, and integrate that with the more broad measurements done by, for example, the air pollution sensors, PM 2.5 technologies, and the radiation dosimeters and other types of sensors. So it's an ecosystem of sensor technologies. Integrating them is a huge challenge in terms of technology. And data comes next.
Thank you.
Thank you so much, Geetha. Our next question is for Este, and you have such a global view, and I think of geospatial science and technology as sort of the enabler of all things in exposomics. What do you think is a very uncomfortable challenge, or what do you think is sort of a big thing that we have to figure out?
Well, I like the way you think, first of all, but we do have a really big, uncomfortable challenge, in my opinion, that I've been thinking about since 2009, and that date's very specific because my predecessor at Esri and one of my mentors, Bill Davenhall, did a TED-Med talk called Your Health Depends on Where You Live, and he called the science behind that geomedicine. And he asked me, after he did that TED Talk, to start thinking about, I was still at UC Davis practicing medicine, he asked me to think about how we could make his vision a reality at the point of care. And I gave a lot of thought to it at that time. My thoughts were all around, how do we collect a place history and store it in an electronic health record? And so that's really where I was thinking. It had to be in the EHR, and so then I had to think about HL7, and it was before we had FHIR, but now FHIR, and I started getting involved in how do we develop a location resource that accounts for, as Bill said, not just your residential history, but your total activity history. So as we all know, it's much more complicated than where you live. It's where you work, learn, play, pray, and do your activities of daily living. So I couldn't imagine how we could get an EHR to do that. And suffice it to say, collecting and storing a historical place history is still a challenge. And what is the mechanism? I don't know that it needs to be an EHR. But looking forward, I think there's challenge and there's hope, but the challenges are different because now we've got all of these GPS-enabled sensors, our cell phones, our smartwatches or Fitbits or whatever we use, and we can collect a lot of data. And so then how do you resolve that data in a meaningful way in order to do this work? And it is challenging. I'll actually share with you that I live my life as a digital nomad. I have no home. I have no car. I just travel the world full time. And I've been doing it for 3 years now. And I diligently collect my own place history. I use GIS tools to track every step I take everywhere around the world. And it's still incomplete, and I know how to do this stuff. So collecting and using a place history is difficult. I didn't even mention the concerns about privacy, and then how you convert that into a population level data set for analysis. So big challenge, but foundational.
Thank you. And for you, Dr. Pollitt, what will be an uncomfortable challenge?
All right, so going last, I'm going to talk about measurements. And I'm going to talk about 3 aspects of measurement. So the first being the technology that we have to measure. And mass spectrometry, high-resolution mass spectrometry is at the core of what we're currently using to measure the exposome. And it's generated great strides to what we've been able to collect with data, but we need to make further advancements in terms of that technology to better capture further chemical depth, further information about time and space. And then the second aspect is related to harmonization. So we can generate tremendous amounts of data with high-resolution mass spectrometry, but if we don't optimize the methods that we're using to do these measurements, then we're not leveraging its full potential. So I'm greatly encouraged by all the ring trial activities within Europe, within the US, especially going forward with Nexus through the BioHub, how we're going to be able to harmonize these methods. And then the third aspect is related to the people. So ultimately, it's the people collecting these measurements. And we really need to embrace cooperation like we've talked about earlier this morning. So we need to embrace the harmonized, the standardized methods so we can move forward. This is going to allow us to align the data that we collect to then be able to then further grow the infrastructures and link those to health.
Thank you.
Thanks so much, Dr. Pollitt. And I'd like to invite our panelists, if you'd like to respond to someone or share additional thoughts, please go ahead and do so, or we're going to follow up with more questions for you. It's not a threat, I'm just saying. Yeah. Ben, do you have anything online?
I've got lots of things because those are really great, really great challenges. I think what I would respond with is the contrast between space and person. And we have become very focused on space. GPS tracking is becoming pretty common and we're used to it. Surprisingly, we tick the box which says, yeah, fine, collect my GPS data, it's fine with me. And that tells us where we are, but it doesn't tell us what we're doing. And there are certain aspects of the exposome which that's pretty good for, and there are certain aspects which are terrible. So knowing where you are will not tell you a great deal about what you're eating unless you happen to be in a restaurant, and even then it's limited. So we've got, I think, detach ourselves from space. That would be my rather biased view on how we do things, because I think we've become a little bit over-dependent on it.
Can Este, I feel like you want to respond to that, so please go ahead.
I would say it's an and not an or.
And knowing Ben and his work, I'm sure he agrees with you. Ben, I'm not speaking for you. But I also want to hear your thoughts. So obviously, everything we're talking about has strong ethical implications. And because we have another amazing session going on, we don't want to sort of, steal their thunder in a way, right? But Ben, you've done so much work with citizen science networks and sensing in that sense, right? Where there's a lot of spatial data, but also about individuals. And what are those, let's say, delineations, or where does it sort of become clear that it's about the person versus about the community? Are there benefits to both? What have been some of your lessons learned in that kind of advancing sensing technology space?
Yeah, it's an interesting question as to whether there are delineations. And I think if you want to work in this space, you have to bring the individuals along with you. You absolutely can't experiment on them. You have to experiment with them. And in many cases, they must feel ownership of a project and an agency within that project to input it, steer it, and have a component of it. And then you've brought them into it. They can feel that they are benefiting from it. They're a part of it. An integral part of it. And that means they're much more open with their data and much more aware of what is then going to be done with your data. And actually using the individuals to share the outcomes with their own community is an extremely powerful way of disseminating that information, because their neighbors and their communities will see one of their own giving the results of the experiments and the studies much greater levels of trust, much greater likelihood of any kind of impact or behavioral change, whether that's immediate or stretching beyond the community. I don't think there can be a delineation between the two if you want to have really impactful research, but it takes effort and time and resources to integrate a community to that degree.
Thank you very much. So it is an and. Geetha, please.
Coming back to measurements that Katie mentioned, I think given the different types of exposures, like physical, chemical, psychosocial, and biological, how do you standardize these measurements and harmonize them? So globally, if we are measuring all these different types of exposures, and are we calling the same in different geographical areas? Are we using the same standards? And what type of technologies? If you can't have interoperability or the data can't crosstalk, we are comparing apples and oranges. So in order to have like genomic efforts where they were able to achieve that harmonization, and also given it's 4 nucleotides and the measurement is of 4 nucleotides and the arrangements of those, we are posed with a different kind of challenge. So measurement challenge and also harmonization standards and the data itself. How do you, and timescales. We are dealing with different timescales. If you use quantum sensors or geospatial sensors, it's on different timescales. Continuous monitoring, real-time monitoring versus snapshots of different times. And how do you combine all that? So that framework is super important in order to at least make one stride or one step progress, is to come up with some basic principles of how to study and look at this in a unified way.
No, I agree completely, as was raised. But I'll emphasize, as we move towards identifying optimized strategies, harmonized measurement protocols, we have to embrace them. And we have to acknowledge that this is going to be fundamental to how we perform our measurements. And in the analytical chemistry space, we're inherently curious people. We're constantly pushing the bounds in terms of, can we improve our sensitivity? Can we improve coverage? And that's fantastic. We have to keep on doing that. But we also have to embrace and accept the need for harmonization.
Also, that can produce actionable results in the near term, like 10 years. And or it's something achievable. You can push the boundaries, but also be in touch with the actionable part of it, where you're thinking about implementing and accomplishing in the next 10 years. Let's say, you achieve 10,000-fold sensitivity for certain low exposure doses, and you standardize those, but yet you, for example, figure out 100 disease environment-specific pathways. So there is some concrete achievables that you can think of.
And in the spirit of continuing to look forward into the future, right, I would love to ask each of our panelists, perhaps Emilie and I, if you were to think, so in your fields, in your expertise, right, this amazing domain that you come from, if you had the dream technology available, if you overcame all these challenges, if you could now use it the way you really want to, what are those new open questions or ways to think that are like wildly different than from how we're operating today? Like, what is that potential that we're missing if we don't figure this out? I know it's a tough question, but I'd love to hear from all your perspectives. Perhaps we start with you, Este.
Well, I guess maybe my thoughts are rather simple, but I would like to get better care in my healthcare life. I haven't told this audience, but I've told other audiences that I have a personal goal to live to be 150 and be healthy. And I'm going to count on this research, amongst other things, to help me get there. So one, can it improve my own health? Number two, can it improve the way that we design and build communities so that everybody can be healthier? What do we learn from that? Like the efforts to recreate blue zones in different places. I think this is a broader view of that. So really, I just want us all to do better. And I think this has the potential to guide the direction.
And that's so important. I just want to add to that because I think a lot of sort of global imbalances, not just in data, but in like availability of technology and how quickly it can be adapted or adopted, I should say, right? So I'm with you on that vision, and that would be my dream. But perhaps, Geetha, if you don't mind, what would be your sort of like the dream thing that I could do if I could develop this technology or get it to scale up the way I envision it can be used?
First one, I'm coming back to integrating quantum sensors with classical sensors, create that network of sensors and be able to talk to each other. And the signal processing would need to be figured out, and the time scales need to be figured out. But that kind of sensor network will give you not only the individual level information, but also the context, the context in which they are. At the same time, macro level. So you are getting down to macro to connect with micro, and then you get a comprehensive view of the totality of exposures. Of course, the psychosocial is a different thing. You can't really measure objectively without questionnaires or some other kind of, wearable technologies. But in terms of biomarkers, analytes and other kind of pollutants.
As we move to Dr. Pollitt or Krystal, I would just like to encourage you to start really thinking hard about your questions. Those are coming up soon. Please, Krystal, dream big.
So for me, being able to incorporate this chemical depth that we have that we can measure at a single time point and then introduce that longitudinally so that we can have that dynamic nature, these personalized behaviors, as Ben said, to capture those over time from very early life onwards and link those to health data. That's really the dream in terms of what we can incorporate.
And Ben, what is your dream?
I've realised what I was about to say might sound a little bit weird, but I was really impressed with what Este said there about wanting to live to 150. So there's two parts of that. First of all, I absolutely agree. The spatial thing is an and as well. But imagine if we had the technology to not only measure and monitor our environment and external stresses, but also our body in real time. So something could tell Este, stop doing that, it's not good for you, and you'll never live to 150 if you keep doing it. And that kind of feedback process, that's kind of a dream, but I also recognize that the world's got some very big, challenging problems. And so I actually think that we need to get much better at implementing and delivering change from the knowledge that we gather. It's all very good gathering all of this data and all of this detail, but it's got to make a difference to people's lives and in an equitable way, not just those who can access the data and the technology.
Thanks. It's funny because it's the same dream as me.
That's wonderful. Thank you so much, Ben. And just a few comments from me because I'm thinking about this too as you're all speaking. I do think that sometimes when we're thinking technologies, we get overly focused on like the technology and the cool stuff and the toys and the engineering, which I'm a big nerd and fan of. No underestimating how cool that is. But I do hope that we can always be thinking of like, what is the knowledge that we can gain from this, right? Why are we even doing this? What are those questions that we're trying to ask?
And how it could help people, because at the end, it's for people, it's for population, it's for everybody. So we need to focus on technologies, but also after these technologies, what do we do with that?
Perfect, thank you. And speaking of people, we're looking at the audience and we would like to invite you up. Please use the microphones, don't be shy. There's so much to talk about. Please, go ahead. Introduce yourself if you don't.
Yes, I'm Ozzy Lozoya from RTI International, former NIHS postdoc. I guess my question is, to what extent do we see the Exposome Moonshot not only to be about pushing the boundaries of technology and sensitivity and new method development, but also having a parallel mandate, which is about frugal science, so we can take this knowledge and actually make it into technologies that are available widely, global north, global south, whatever, at a cost-effective manner. Thank you.
Who would like to take that from our panelists?
So I can start on the measurement front. And as we think to harmonizing, we can think about a minimum set of compounds to measure that would provide the ability to characterize. And one of the goals that we have with Nexus and developing these harmonized methods is also to generate an exposome kit so that people would have the ability to have this more equitable measurements of the exposome.
I think I would probably focus on the title of this panel is Technology is an Enabler, it's a tool, it's not the thing to focus on. I think the methods and how we use technology to solve the problems is the thing to focus on. And then kind of like, you know, specialized drugs, they become generic eventually. So once you know the methods, then you can apply technology in different ways with different tools. I would just say from an Esri point of view, you know, we try to make technology available in places where it's difficult to afford. So with grant programs and things like that, I think that tech companies can step up and support that. But I also think that the methods are really what translate across technologies.
Thank you. Go ahead.
Hello, Jennifer Kerwin, Berlin Institute of Health. Full disclosure, I'm a metabolomics specialist, which is where this question comes from. There are multiple challenges with measuring the exposome, not least that we're not always sure what the most important parts of the exposome are to measure. And there's some very good data to show that the metabolome acts as a beautiful link between at least the microbiome and the immune system, and I suspect the exposome and the immune system. So my question to yourselves, thinking about how the human body has a very limited number of responses, what's the right balance between measuring lots and lots and lots of chemicals or using basic biochemistry in an individual to measure the lifetime exposome without necessarily understanding exactly which chemicals they've been exposed to, but we're just measuring the effects?
That's a good question in terms of what's the depth and the extent we should go before we start using the information, and when it becomes, what information becomes critical, important. The key drivers in terms of human biology and biochemistry, so identifying the key drivers of certain disease pathways. You can leverage the existing data, the developmental and disease-related pathways, and see certain exposures, how they interact with this biology. And identifying, again, requires not only the assays, but also data. So the really important is to analyze in a critical way and not pick candidate pathways, but be comprehensive and using data-driven approaches, identify the key drivers and validate that with, cross-validate that with existing biological information. So when it comes to exposome, it's limitless because there's so many exposures, and we know there are already certain set of exposures people are studying, and you can continue to expand on that, but there are already a set of exposures and measurement technologies. And my guess is here, like we want to expand that. That's the goal of this. And again, it comes to data analytics.
So I'll briefly add that there's been a lot of mention about actionable solutions. And if we truly want to be actionable, we have to understand the source. And that's where the additional layer of measuring the chemicals, all these other external factors comes into play.
Great point, Krystal.
Yeah.
Hi, Ashley Taberge, University of Washington. Thank you for an inspiring panel. I wanted to thank Krystal for bringing up the standardization aspects of the measurement side, and I just wanted to ask a question back to the panel about the data collection and the pre-analytical side of standardization. So as we think about developing exposome kits and getting them into the hands of citizen scientists, how can we ensure that there's robust collection of the sample in a way that it doesn't interfere with the downstream measurement?
So when we think about harmonization, we can think about the analytical side. We can think about the computational sides. But that stretches well beyond that, even to the sample collection sides, the sample preparation, and transport and storage. So all those aspects are embedded within that standardization, in my view.
And if you don't mind, I want to take it to Ben online a little bit, because part of that question was for citizen science. If you were to standardize like a kit that you might give to people, just from your experience with air sensor networks, have you learned anything about sort of, what were the key things to provide, or instructions or design elements to make sure the collection or measurement element is happening in like as optimal of a way as possible that you could share with us?
I think my first point was don't assume people are stupid. If they feel a part, they will try their best, and they'll usually go to quite surprising lengths to deliver what you've asked of them. But they have to feel engaged. Some and piloting, etc., things we already know about. I actually did a project with Krystal, which I'm sure she'll remember, and the challenge there was not gathering the data. It was because Krystal was measuring so much, it was disseminating the information back to them in a way that was meaningful to them. So it's not, don't stop the thought process at the gathering stage. You need to think it all the way through when you're working with citizens, right the way through to the end of the project, so to ensure that they are getting everything out of it that they expected to get out of it in an impactful and meaningful way. So it's going beyond the practical considerations of designing the fieldwork in the first place, right through to the end.
Thank you so much, Ben. Should we go to you next, please?
Hello, I'm Juha Pajola from VTT Research Center of Finland. We have been working last 5 years on HEDIMED EU project, utilizing all types of data, from the wet lab measures to sensor measures from different types of health record measures, and including also the satellite remote sensing data. So how you see how we in practice can bring all of these highly multimodal data types together for exposomic research so that they are reusable, and analysis and all the studies are reusable, and at the same time we can engage the companies to give the data, because at least on the I'm working also within this kind of people who are developing sensors, and they are working with the companies developing sensors. Most of that mobile phone data and sensor data, they are actually behind the companies. They are rarely available for the researchers. So how we can standardize, as mentioned earlier, this kind of highly multimodal data for exposomic research so that it's repeatable, and at the same time also engage the companies to bring the data, or enabling some ways how the companies would give the research data for the people. And then I'm not going into the regulation, but have to say that how we maintain the consent of the people, or some other ways, because in Europe we have also other ways to get the data than the consent itself, how we keep this one up together with all of that.
Thank you.
Bit complex question, but something which is in the core of the whole thing. I have been fighting with these problems for the last 5 years in HEDIMED project, and we continue fighting with it.
Thanks so much, and we're all fighting. But Este, would you like to add something?
I don't know if I'd like to add anything, but I will attempt. Just to say from my perspective, one way to standardize or integrate multiple different data sets is by geography. But I will note that even that is complicated. I mean, country borders are often disputed, and you can't even always standardize on a geography very easily. But a lot of people are doing interesting things with using non-political boundary geography like hex bins or other tessellation grids to make that a little bit easier and still understandable. And as a side bonus, it also helps anonymize the data a little bit more.
And if you guys don't mind, I'm going to just quickly add to that. There are two ways to do it. One is you engage with this process and you come to the working groups and you make sure you share your insights and what you think should happen so we can roadmap this together. But two, I think to Ben's point, I feel like in our exposure science field, oftentimes we're talking about all these amazing measurements and the satellites, who I also love fondly, right? And we're measuring space and time, but exposure is linking to the person or the population, right? So when you're trying to integrate data, you always have to center it on the person. And to me, at least how I think about it, that always makes it easier to figure out how am I going to even try to integrate all this. But I'm not here to share my thoughts, so please, could we go to you? Thank you.
Hi, my name's Aaron Manisov. I'm from UTRGV. I'm a clinician scientist, and I know that when you get 3 physicians in a room, you have 17 different opinions. I'm wondering how, because I also believe that harmonization and standardization is the key, or are the key. One is, how do we get everybody to sing the same song? And how long do you think that's going to take?
Genomics field has done this, and there are lessons learned from it and other areas. So there is a consortium, and they talk about standards, and they agree upon standards, and they publish that. And then the rest of the world refers to that. And so that kind of effort may be needed in order to, as one of the audience members said, when do we stop? When do we talk about standards on an agreed set of variables? And so maybe you could start with that smaller set of variables where you have sufficient information, you can get started on it and expand that framework, seed that framework with this set of information you already have, and continue to expand on that. And then you can get somewhere with that. And that agreement and bringing these opinions and everybody doing that is what is needed.
So we do have an online question, and we have about 3 to maybe 5 minutes left because we started a little bit late. I would like to ask, our colleagues still waiting to ask questions. If we manage, please try to keep it very brief. But should we go to online, please?
Yes, so the question is from Rob DeVoskin. What about the challenge of being able to measure and identify an early initiation event in the pathway to a disease, where the treatment for that disease or even the probability of disease progression is not yet available? Would one tell or not tell someone that they have a precursor to a currently untreatable disease? So that's the tough one.
That's a clinical question. I was pointing to you, but the early detection of disease is a big topic, and whether you tell depends. So for return of results, if it's an incidental finding, then again the LC framework comes into picture. We need to have that LC framework, just a baby ad for genomics, is how do you communicate those results? And you want to be confident about that. So again, it ties back to standards, and so informing the individual is a responsibility, and again has to follow the LC framework.
Yeah, I think it's not only an individual choice, but it's a cultural choice. I mean, we already know in healthcare that some cultures, I had one patient whose family would not allow me to tell them that they had cancer. And so then I had to even rely on secondary person to to understand that cultural reference. So I think, yeah, you really have to understand where people are coming from, give them a choice. I think it might be something like genetic counseling. You know, is there a cure? Like, I don't know if I would necessarily be tested for a genetic disease where I could not take any action, even if that included not having children at my age. I'm not going to, but but I'm still going to live to 150. So yeah, I think maybe it's more about counseling than making the decision up front.
Thank you so much. Could we hear the questions real quick, if you don't mind, from both of you? And then we'll see who can answer those. Was there more?
There is one more question.
Sorry,
but
I did not see
maybe
you.
we can just say, keep, if all the questions are not answered, keep your question and ID for tomorrow, because there is a breakout session. A little publicity.
Great point. Thank you, Emilie, for reminding me. Okay, so with that, I'm sorry, you guys, but please hold on to your questions for tomorrow. Emilie and I would like to thank you all so much for engaging. Thank our wonderful panel. Please give them a round of applause.